Brilliant, brilliant introduction, and thanks for organizers inviting me. And as you said, Sean, first time in my life in 2005 when we arrived with family in Belfast, I became double mister because, you know, I didn't know that rule that surgeons are misters. And anyway, you know, when you ask who you are, you should put in front of you Mr. So I said, does it mean that now I'm surgeon and Mr.? Is it double Mr. or not? And they said, no, no, no. It's just one bigger, little bit bigger than, you know. Because I said, what's distinguished between normal man, who is Mr., and surgeon Mr., you know, so nobody could explain that. So, but in my whole development as a doctor, I always was keen and trying to combine modern medicine and ancient medicine. And being from Lithuania and being so close and occupied by Russians so long, we've been influenced by what Russians do well. And they have amazing history and experience with fasting. And my kind of experience with fasting started when I needed to try it myself. And it was very funny because one of my patients said, would you do that with me? And I said, why not? And that's how I am doing fasting, you know. So usually we try it at least once for 3 days every month. Sometimes it becomes 5 days, becomes 7 days, depends on how you feel. And I'm saying there is nothing white on black that you can apply for everyone. And if that would be the case, we would not be sitting here and discussing, because every patient is different, and my motto is find personalized approach for every patient. You go through deep, you know, history of patient, his genetics, his background, his mom and dad and grandparents, and you try to figure out what's not working, why that patient landed on your doorstep. Because I'm saying if someone you met or came just for MOT, and they are happy, healthy, sleep well, digest well, I'm saying just please do what you're doing. Don't change anything. You know, if you feel fine, tell me what you're doing. I will keep notes, because maybe I will find someone else I can tell, this guy did this and it worked for him. But if you landed on my doorstep with symptoms, something is not working, obviously. They need to change something. Einstein said it's very silly to expect change doing the same thing. So if someone attended with a symptom or worry and they don't want to change anything, I don't agree to help. So there is no point starting the conversation or any treatment if patient is not willing to look into what they need to change in their life, because something already is not working. So my principle is we sign agreement with every patient that they agree to implement at least one change, what, in my opinion, would be number one to do. And usually it's adjustment in diet. And most simple is, now most popular, forget about breakfast. It's no longer the best meal of the day. It's now scientifically proven that we're still digesting dinner at breakfast time. So we can't physically advise or say that breakfast is the best meal of the day. And intermittent fasting worked so well for so many millions and billions of people because they skipped the breakfast, which is natural. Nobody in the wild, no mammal or wild animal would eat breakfast because we are still digesting dinner. We need 16 hours to get rid of dinner. So it means if you finished your dinner at 6, which is very rarely, you can have next meal at 10 a.m. And this is physically intermittent fasting. So at least if they try 1 or 2 days per week to do that, they straight away see the big difference. And that costs nothing, actually saves money. So my whole experience with low-dose medicine and microimmunotherapies started not so long ago, just July last year, when I first time heard about Guna, and I said, I'm very open to different things. And through my clinical research experiences and clinical trials, I participated in bioresonance, and I thought how this can work, you know, how this quantum physics, what it does, how it's, you know, and I was asking these questions. I asked Professor Nesterov in Moscow, who developed the whole principle 30 years ago. He said, you don't question you don't need to know how atomic bomb works. You know it works, and you take it as granted. So he said you don't need to learn whole quantum physics to be able to explain to patient how that machine works and can scan the body and show is there a virus or not. And it's most simple, approved tool at this moment in the world to check is there a virus in the system or not. And it can take 10, 15 minutes, and you can show it on a screen for patient. And if that is not convincing enough, you can do kinesiology. And kinesiology is a simple muscle testing that more and more is used now by everyone. And you can, actually, let's do it. You had a lunch, now it's time to stand up. And as I promised that I'll show you a very simple tool. You know, in kinesiology, you take patient's muscle and you test it. Is it stays strong or gets weak? Depending on suggestion, depending on points in the body, but we can do that on our cells. Kinesiology is the same principle that you ask your body a question and you get yes or no answer. So now we are standing, let's try to sway forward, how it feels, and let's sway a little bit backwards, and again, forward and backwards. Yes, we need to stand shoulders apart, find the middle, and don't do anything. Just relax and stand in the middle without any movement, close your eyes, and now in your head, not loudly, but in your head, just keep saying yes, 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 and feel what your body is doing. Usually around 85% people go forward. It means your body is showing what's positive, it's forward motion. And you get little nudge just to feel what it is. Then you go back into the middle, you find your middle, you relax, and you close your eyes and you say no, 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 and you will feel you're going backwards. So that's your body, inner wisdom, talking to you and showing that your body is reacting, not stubborn. It's not for everyone that works from first time, but this is sway test that you can Google, you can YouTube. Many kinesiologists explain it. It takes 5 minutes to learn, and you can apply it. For example, let's now all close our eyes and ask, do I have Epstein-Barr virus? Sometimes you need to repeat that question in your head 5, 6 times. Is there anyone moving forward? Sean is moving forward. So Sean, after it says you have Epstein-Barr virus, you ask a question. Would microimmunotherapy against Epstein-Barr works for me? He's moving right and left. So neither yes, neither no. Okay, now, so my point is that you can test anything. Let's say, let's go now to the other cytomix. Elena, can you bring cytomix to the Sean that he can take it in his hand? Because, okay, I think I have in my bag, but so one point, you can ask a question and your body will either sway forward or backward, and you have very quick answer about yourself. For patients who are interested in that, I have Gunavirus. Okay, let's try Gunavirus, because you can take any substance into your hand and ask, is this good for me, or will this help to fight against Epstein-Barr virus? Because one thing is to have Epstein-Barr virus, another thing, do I need treatment for that? Because as you all know, yeah, it's better to take the medicine, for more sensitivity, it's better to take it without paper, cover. Exactly. So now, because I already was ahead of others, I bought Epstein-Barr virus pack. So Sean, take one and just ask a question. Will this help me to fight against Epstein-Barr virus? And you can see straight away forward motion. Okay, now take cytomix, yeah, and ask, would this be fighting against the Epstein-Barr virus? And there is no big motion. And then when you have two yeses, let's say cytomix and microimmunotherapy, you can ask, is this, you don't need to take that, but you just say, is Labolab better than Guna for me? And you can see straight away patient is going forward. So you can choose between 2 or 3 options that you are thinking very quickly. Yeah. So it's, you know, I was doing the labs and everything, and the second I was getting the results the same, that bioresonance. Thank you, everyone. Thank you for participating. So when labs confirm active Epstein-Barr virus or reoccurrence of Epstein-Barr virus, I do the sway test or muscle test, and if that is positive, so I had 98% accuracy comparing actual lab with sway test. And that was the same when I used it bioresonance. So I'm now having 2 tools, kinesiological muscle testing and bioresonance, and patients actually don't need to send their bloods for another €100 to get another confirmation that they have Epstein-Barr virus. For someone who really likes tests and bloods, of course, and they can pay for them, it's absolutely. But that €100 they can spend on 2 months of treatment, you know. So it's, you know, when government covers that, absolutely no question. Labs are perfect. When patient needs to pay for them, you know, as I said, if it clinically looks like, if it sounds like, if it smells like, if it tastes like Epstein-Barr virus, most likely it is Epstein-Barr virus. And the beauty is that with, you know, Labolife or Guna products, it's very close to 0 that we can harm patient. There is, I don't know what is possibility to harm patient. If that treatment is not right, patient will report to you. If he will start taking and sway test will show stop it, I'm saying stop it. I always say, go with your gut, ask your body, and if you feel not right, you ask sway test and it shows, please don't take it anymore or make a break for a week or 2, go for it. Like, I don't ever recommend do 5 days fast. No, you start with 1 day, and at second day you ask, should I continue? If body says yes, you do second one. I started 1 day fast and I ended doing 10 days fast. So, but you go with your gut, you ask, is that safe? Should I continue before you kind of, we forgot that we have gut feeling that women are much more connected with. Men, they never thought that they have it, but with sway test, you can get your body talking. So, sorry for that long introduction. So, as I said, because we heard from the net a lot about Labolife, I thought I'll focus a little bit more about Guna and low-dose medicine. And before I go there, I just wanted to show you American Heart Association classification for clinical trials. And now, me and other presenters will be talking about case studies. Renata presented case study. Every case study that is published is level 5 evidence. And more these studies, as a one-patient case study is published, we have more and more evidence to prescribe, to do this or another. Of course, amazing is level 1 studies, but they are sometimes difficult to interpret, and sometimes they are just 10% better than placebo. So, of course, it's brilliant and very expensive to have level 1 studies, but level 5 human case studies are also quite good evidence that we can use. So, as I said, level 5 study might not be the perfect solution for, you know, spontaneous fluctuations in seasonal flu or something. But more and more good case studies are published in Alzheimer, Parkinson's, cancer therapies. You know, other patients will consider as another choice to try that. I am a big fan of bioresonance, and because I started using it many years ago because my dad had prostatitis and nothing worked against that chlamydia. And at that time, I found the papers. I contacted Professor Nesterov, and I said, you know, your machine looks like can detect any virus or chlamydia, and you have a frequency to kill it. He said, yes. So I bought one, and we tried it, and it worked. But before, he had prostatitis from he was 21, and he was 55 years. So his 35 years was chronic prostatitis with ups and downs and, you know, sensitivities. And he tried all possible antibiotics up to the cephalosporins 4th class. And chlamydia was not killed. So after the bioresonance worked for him, I said, I'm good. I can offer this to my patients. And now, if you look about insurance, if you want to do bioresonance for your patients, insurance companies regard that as a safest tool, and it costs for around maybe 100 euros per year to add to your insurance. So you can't do any damage with bioresonance because it uses radio-like frequency, and that scans the brain and shows how brain perceives your body at that moment. Looks for functional intolerances. There are a lot of scientific papers, a lot of proper clinical trials published, and the website that contains most of them is Clinical Metafia, and the website is there, nlsdiagnostic.org, and you can go there, research what's been published for which conditions bioresonance was used in proper clinical trials. I use the Hunter Metafia 4027, which is one of the most advanced at this moment and fastest computers, and it's quantum physics computer. And I always surprised how it does. To do a scan, you only need to put patient's date of birth and male or female. If patient knows blood type, it's better because it gives a little bit better recommendation regarding what foods suits patient, mainly based on blood type diet. And you can do one system scan in 5 minutes. And you can do full body scan MOT in 45 minutes. You can choose what systems to scan and which parts of the body to scan.
Just quickly, is that diagnostic only or is it treating as well?
It's both, yes. Initially, of course, you do diagnostic run, which machine does automatically. You just click the button and it runs whatever you ask to run through. And at the end, you can choose results. You go through them. You look for viruses or not. Parasites, toxicities, heavy metals, sugars, chlorine, fluoride, whatever is causing for that patient issues. And as I said, the whole scan is happening through these modified headphones, which have sensors inside. And these machines, when they were developed by Professor Nesterov, they costed 10,000 euros. Now the patent is out, and you can get Chinese copy. This is Chinese copy, certified and with all documents, just for around 1,500. So it became accessible and, you know, easy to use.
Have you ever, because I have like a right machine and different things, but I've never really done what I would look to. I wonder, have you done, where you would compare the results that this finds with, say, labs? So if it finds...
I did it for my purposes, but it's not published yet. Yes. So I have 10 cases where it was 100 confirmation of Epstein-Barr virus, but it's not yet online. So it means, yes, I looked, I know that, but as it's always when you're busy clinician seeing patient, it's difficult to sit down and put that in a paper. And I was thinking, you know, it would be good, actually, I don't do any more bloods because I don't, you know, it's extra cost for patient. But for some countries like in Austria, if government is still covering that, it would be amazing to see comparison between bioresonance and actually lab results. How accurate it is and how often, you know.
Do you not find, because somebody put me on one of these machines that found a whole lot of traffic. I haven't been to the tropics yet. Sometimes it seems to find...
Yes, there are always it's not the machine for everything. And sometimes, as you said, there are things coming up as possible issues. It depends on who interpreting results. You know, if you are medical and if there is no back history patient being in tropics, obviously there is some glitch in how machine detected. And there you always will have something, you know, is that possible? And if that is not relevant in whole patient clinical picture, you just disregard it. You know, it's the same, you know, we always have, you know, one-off migraine or, you know, swollen joint for maybe because patient slept or maybe, you know, had too long run. You know, you can have off symptom or off something which you just take out of picture and then you make your judgment. So my case would be a 49 years old female who had chronic fatigue and anxiety for last 10 years. And talking with her and going through her history, we found that she had one episode of, you know, fever with swollen lymph nodes, sore throat, but not like flu-like symptoms, which disappeared itself. And in her life, in these 10 years, were many bloods done, were all normal, like GP says, nothing is wrong with you, we don't know what's wrong with you. So the bloods don't show anything abnormal. And during her general exam, she looked a little bit weak, but diagnosed with bioresonance as positive Epstein-Barr virus in thymus, and kinesiological testing as well confirmed the same. And I started her on combination of Guna products, Cytomix, Guna virus, Obiflor just for gut, Guna stress, and always I add vitamin C. Because before I knew the low-dose medicine, vitamin C protocol was one that worked for so many patients. You go, you know, with oral vitamin C to high dose to the level that patient gets diarrhea, you reduce it a little bit, that diarrhea stops, and keep that patient for a month on that vitamins high C, maybe 10 grams or 15 grams, depends on patient, and they always improve. And, you know, so, you know, IV vitamin C, you know, like for nearly every chronic condition, and cancer was tried so many times, but nobody will, I think, start prescribing it massively because there is no business in that. You know, it will be never approved in level 1 clinical trial as a treatment because. So, on that note, I just want to show you how machine presents the scan. You can have colors represent different areas. Every color, every dot on every organ, frequency is assessed and colors assigned. Depending on color, you can see which part or, you know, of that organ is not functioning properly. And on her left side, it was much lower function. Inverted triangles means that system is nearly decompensating. It's still functioning, but it's just losing the capability to function. And this is the comparison. Then you can use bioresonance machine when you identify virus to kill it virus. So this is showing, yes, this thymus on the same day had positive Epstein-Barr virus. And this is improvement. All these inverted triangles were gone after using 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 treatments with frequency. So my patients reported many times, and I said, to know that this system works, we need to do just this. I can't say, let's do bioresonance, take microimmunotherapy, let's combine everything and see how, you know, if you're curious and you want to see that this is the thing that works, let's do therapy, come back after 4 weeks and tell me how you felt these 4 weeks. And they always feel improvement, but usually at the end of 3rd week, they feel energy is gone, Epstein-Barr virus is up, because it's not enough one session of killing virus, because it's like, you know, you can do something, you can, Reiki works, energy work works, patient, you know, even simple reflexotherapy works. They feel better, energy goes up. You can stimulate immune system different ways. You can put needles, acupuncture works, but you want long-lasting effect. And eventually they will need to have something to stimulate immune system, either low-dose medicine or like from Guna range or from Labolaf, something they need to help to get the immune system up to speed. As I said, machine only, yes, it's useful, but it's not enough on its own to cure patient. So And that's the end of my case. I've had another few similar cases with the same results, more slides, but yesterday when I was driving to Dublin, I had a clinic in Dublin, I got sore back. And I thought, I need to see someone who can check what's wrong with my back. And I went to my good friend, Vladimir Tolkachov, who is a doctor, and he is working with the backs, and he checked, I had a little massage, and he suggested that we can try, we can try gunapheresis. And that's why I changed a little bit, just to introduce few techniques, how I use, and Vladimir is using gunapheresis to introduce sterile medicines under the skin. Because we will have next speaker who will explain that you can inject sterile collagen or sterile homeopathic mix for improved microcirculation with a needle, of course, old way. But in my practice, I use a lot mechanical injector, which is used in beauty for injecting hyaluronic acid into the lips, into fine lines. And this is the mechanical device that creates mechanically pressure, and you can shoot it under the skin without needle. So you buy a device which is around 60 euros. You buy single-use little syringes and, of course, single-use needles. But needle you need only to take medicine in. So this is the same syringe as a big syringe. For demonstration, I will take just water inside, and I'll just show you. So this device, because it's completely mechanical, by untwisting, you're making a space for the plunge. That plunge can go in. And you can inject sterile solutions like Guna Collagen, Guna Made, and other sterile specific formulations that are created for injections with mechanical device. When you create pressure, you can regulate how much of medicine you want to go under the skin. So by twisting it, every time you twist 0.1 mil is kind of like checked in, and it will go out. So when you create pressure equal to 0.3 mils, medicine starts going out. You can't create more. Maximum you can inject is 0.3 mils every time. So now, if you look into the plunge, which you can see black, when I push, it just shoots out. And that is enough for medicine to go under the skin and affect tissues under the skin. It can go up to 3-4 millimeters under the skin, depends on skin thickness. It works amazing for beauty, for cosmetics. It works amazing for activating acupuncture points, like stomach 36 point for patients who have fatigue, and they are, nobody can find reason, and they all want a quick fix. So I always inject them with either lymphomyosort or with Guna's Made solution, which is mix of herbs, sterile solution into active points. For someone with digestion, you can inject them just, in the middle, between your... So you can use this as a tool instead of putting needles around, just inject. So with with one syringe, you can do 3 injections. I'm creating pressure again, shooting out again. Of course, it's a little bit at this moment disadvantage that you need to disconnect, take more medicine, put it back, and shoot it again. So, but to treat a patient, you maximum need 20 minutes to inject maybe 15 times. And I never did more than 15 injections for immune system modulation or acupuncture points modulation. So you create pressure, you shoot again.
How are you picking the 15 sites of administration?
Because I'm acupuncturist as well, I'm choosing acupuncture points and meridians that, in my opinion, would help that patient to get back to balance. So with this, I'm activating and rebalancing meridians, acupuncture points. With low-dose medicine or Labolife, you're helping the immune system to catch up. with bioresonance, if I identified virus or parasite or bacteria, I can kill it and help patient quicker to get back to normal homeostasis. So, to demonstrate gunapheresis, which we have at the back, I will invite Vladimir, because we still have time, and because he has device, and after yesterday's application, my back is perfect. And I tried myself, I injected myself with this, my back, because it was, yeah, just, you know, you can create the pressure, and you need to keep it tight against the skin, and you can shoot it in. So I find the spot which is painful, and I inject it. It reduced pain 50%. But I injected myself with Traumil because I didn't have Guna collagen. And Vladimir, he had Guna lumbar collagen, specifically designed for lower back issues. So it's sterile collagen with herbs that is specifically designed for lower back issues. And after gunapheresis, I'm standing here today.
Where do you purchase that injector?
They are available now on eBay. Maybe a little bit more expensive, around 70 euros. But if you buy directly from China, it's around 50 euros.
What's it called? What name?
Mechanical beauty injector.
Needle-free injection system.
Needless injection system. Yeah, needless. Or either hyaluron pen. Yeah, they call it hyaluron pen. Yes.
Hyaluron pen.
28, 30.
Hyaluron pen.
They're also called air jet injector.
Air jet injector. Yes.
I need to buy needle.
So these photos are presented by Vladimir, and he has his own website, manualaestheticmedicine.com, and unfortunately, I don't know why this is overlapping. What I will do. Yes, I will just delete that and delete. Where is delete? I. Okay, yeah. Do you have it? Menu. So this is, yes, so this is the Vladimir's website coming up. How to present that? Да. Хорошо. Да. Веб-сайт, да, есть. А как его показать? How to set... Да. How to present on the screen.
Might be able to. Is there a way we can project that? That's the project of the screen? No?
This-
Just that page. It is, but it's just the internet.
Oh, yeah.
Wow. That's the brain.
Perfect.
Oh, wow.
Thank you. So this is his website. This is what he is doing, and today he has gunapheresis device. He got what 3-4 years ago, yeah.
3 years ago.
And it was amazing. It worked for my back, and that's why I said, I'll skip my part about Epstein-Barr virus. I want this for people to see. And as you can see, Vladimir, he has 2 probes. One is for face, one is for bigger surfaces. And you can push using this electromagnetic field, which is created around the probe, the medicine, through the skin to the depth of maximum depth 3 centimeters.
3 centimeters is enough for spine.
Yes, for spine he used 3 centimeters depth. but you can use it for around 2 centimeters depth or 1 centimeter depth. The depth you can regulate, how deeply you want the medicine to go in. And that's, it's available on Guna website, it's available through Biomedica, and it's another non-invasive way to get, sterile solutions through the skin at whatever depth you need to get it. So always, Vladimir is happy to demonstrate and how it works. And if we can get a volunteer who wants to have, if anyone has a sore joint or knee or elbow or here we are. So Vladimir is happy to show how it works and how the process is. And it again, for a treatment, it takes around 25 minutes altogether, because actual treatment is between 10 and 15 minutes. So in 10-15 minutes, the medicine is pushed through the skin without any injections or shootings. Because I like this, because you can shoot the points, acupuncture points. This is my kind of little bit invention, because nobody did it before. Nobody used injectors to activate acupuncture points. But I did it a lot with needles, and now I don't need to poke anyone with needles. So I just do the shots to the acupuncture points I think are beneficial for that patient. And this one, you don't need to shoot anymore, because that pen, if you will play with it, it still scares a little bit patient. So what I will do, I will make it empty, so everyone can try. So when you load it and shoot, of course nothing moves now, there is nothing to inject, but the fact when it's loaded and you touch to the skin, you still get that little, whoa, something happened. And they can see little, yeah. And
sometimes blood.
yes, so if I do around between 10 and 15 shots, 1 or 2 will always have 1 little drop of blood. Because if you hit it, it goes in between cells of the skin, but if you hit it capillary, it will bleed. And if you do it on face, you can get a black eye. So you need to explain it. So for beauty things, yeah. So I had a lot of...
So for beauty, can you reduce the strength in the...
Yes, exactly. So you can regulate how much you want to get under the skin. So from 0.1, so 1 twist is 0.1 mil. So if you, maximum you can inject in one go is 0.3 mils. And that's why, you can kind of play with it. So
Will 1 mil hurt less than, will it make less of a
yes,
impact? Yeah.
exactly. Because the more you inject, more chances that it will bleed. So you can load it and try how it feels, But again, it is pen shooting, and for patients it's like, it's better than needle. But, this is another way of getting medicine in. And yes, Yelena has the links, and so you load it. No, you just load it because now it's empty. Yes, now. There, but you can just touch your skin and feel how it feels. So the moment you shoot, of course, there is a little sensation because something is going under the skin, but it's never pain, it's never like injecting the needle. So, volunteers, who has, oh, we have another volunteer, but we have 2 ladies first, so now how we can choose who is first? Yes, absolutely. So what we can do, either you can sit and... Huh? Okay. Yes, yeah, no, we can.
Try a gin and tonic.
Would it be better if you sit on the bench and kind of balance here?
Okay. So, so you can use patient in sitting position, in lying position, because, no, you sit down.
Это зависит от того, какую область делать.
Да, because Naida asked for her neck, we will ask her to bend forward and just put the, yes. So what we need, the only area of where she's complaining about, yes, absolutely, yes. Yes. And then, you know, the whole principle is that you need to mix sterile medicine with the gel, because you can't put the sterile medicine on a skin, it will escape. It will run off the skin, and there will be nothing to squeeze it through the skin. But Vladimir is getting his clean bowl, uses the specific Guna gel that is specifically designed to be mixed with sterile medicine.
Modestas, sorry to interrupt. Maybe people can move.
Yes,
forward
you
a little
can,
bit
yeah,
because
exactly.
No one can see anything.
Because all Guna collagen, sterile collagen medical devices are coming in vials that are, you know, every patient can see they are sterile, they are closed and sealed. And now Vladimir is just choosing the which one, because as I explained, the Guna medical devices, they are specifically designed for different areas. Guna Matrix I use for beauty and for face, for anti-inflammatory joint issue or neck issue or lower back issue. We can use, there is Guna neck, I think, and there is Guna thoracic. Yeah. So you can see this, you know, has the expiry date, you know, and it has the sterile seal. When you open it, what I would do, I would use that single-use needle to take it into the pen. And actually we can demonstrate how it looks, injection with a pen and injection with, not injection, but comparison. Yes, because I have sterile needle and sterile syringe. Yes, so while Vladimir is getting ready, I'll show you. So this is how single-use syringe comes. So patient sees that this was, you know, sterile. You see the date and everything. This is the single-use needle, again sterile, which you connect to the syringe just to take the medicine out. And now, because this was just opened in front of patient, I put some air inside just to get pressure. So you fill the syringe the same as any syringe. Sometimes you can get little air bubble. Here we are. There is a grading that is not allowing anymore to take. Can I have the pen? Thank you. So this was my, you know, so now this is sterile, never used, single-use syringe full with medicine. And to load it in, I need to unscrew it. That whole plunge can go inside. Because if you don't do that, by squeezing it in, you will get medicine out. And when it's twisted, I load the pressure, and now 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Yes, now it's maximum that I can inject. So I created the pressure. You can see I no longer can create more. It starts squirting out. Now I ask Naida, where is the painful spot? And you can inject it straight where the patient shows the pain. And you can use the sterile gauze to clean the skin, but you don't need to because there is no needle. You get it close contact and you shoot it. And you can see straight away the medicine is in, and in 2-3 seconds the little lump will go up, because if she complained, so now I create pressure again, I can't, create more pressure, and I would do opposite one, again, close contact with the skin, and another shot. And you can see that it lifts up, we have medicine straight under the skin, no bleeding, not even drop. Of course, for her, I would do injection for acupuncture points as well, and it would take, the whole vial, because it's open, I would use it to inject that area to treat not just painful spots, but acupuncture points as well. But because Vladimir is now taking from the same vial medicine into his syringe to mix it with gel, we will see how it works. And actually now you can see little spot, where that was injected. So therefore, sterile gauze is always good to have with you.
And the left side was more painful at the moment of the injection.
Yeah.
And here is a more pump?
Yes. On left side, there is,
More sensitive, yeah.
more sensitive.
It's more
Yes.
sensitive.
So exactly. So this one vial is enough to treat, any local area, and at the same time, I use that to activate acupuncture points necessary to help patient to get better quicker.
Can I have a look?
You didn't mix it.
And
You just got
one needle with one syringe costs around
okay, little bit.
€2.
Okay.
So,
I didn't see.
So
Because
the-
without gel, it's impossible to do this manipulation.
Okay.
Gel is necessary.
Okay.
Так,
It's
ну,
like a gel for
Gel.
the
Yes.
hands.
Yes.
Same position, same position.
давай там.
I'll hold that. So Vladimir, he mixed the medicine, that sterile collagen with gel,
Yeah.
and now he's applying it on the skin, because with gel it stays, it's not running off. If you put only sterile vial, it will run off and there will be nothing to push through the skin. And as you can see, he can cover a bigger area, and it means you're treating not the dots. And you can see what happens after these injections. There are little redness, and but this will go away maybe in 5-10 minutes. So you don't do that if patient on face, if patient has tomorrow event or wedding. Yes, exactly. Because first of all, you don't know for how long that redness will stay. To get the medicine in, you need to cover it with a
Не инфицировать, потому что разным людям не делаешь, можно инфицировать, и вообще оно будет хуже, если делать непосредственно на коже.
Yeah,
Поэтому
you
делать
could try and use this probe straight on the skin, but because he's using that for different patients, for medical cleaning reasons, he always uses the plastic, and it's easier to manipulate and move it above the plastic sheet.
She feel nothing,
There is no sensation. Yeah.
because nobody feeling magneto.
There is
magnet
magnet,
поле.
yeah, there is only magnet field that is pushing the medicine through the skin. And the Guna has all explanations on the website how it works, how you can push through any cream, any substance, even ibuprofen, through the skin using magnetic field.
And you
But does
can
it not
choose
still have the
that
normal dependency
how
of
deep you do.
chemical Dalton size and
You
so
can
on? So you
choose
can't,
how deep you want.
is that right?
Yes,
It still has to be porous to the skin.
How many
yes,
centimeters?
exactly,
You can't push
exactly.
it in.
Something that's not,
3 centimeters.
every cream
Okay,
that's being
okay.
developed for pain management has this capacity to go through the skin. So this device and this method allows to push through the skin any substance that can be
Go through
pushed
the
through the
skin.
skin. You can't push the powder, or you can't push the tablet through the skin. But usually all liquids and creams, you can help with this magnetic field to push through.
But there's a molecular size limit, they call the 500 Dalton rule.
Yes,
You can't
exactly.
get bigger.
Yes, exactly. And and it takes around 10-15 minutes.
It's my choice. I can put, as a rule, 10 minutes, sometimes 10, 15.
Okay.
As a rule, 10.
And you can please select wave, and you can
Yeah, it's displayed.
So now he's has, you know, the maximum it can squeeze through.
And he is therapeutic, wave and beauty. Wave if we are working with face, beauty therapy.
And P for? And P is for?
B, T, and this one we don't use. P, I don't know what does it mean.
So yes, all questions to Vladimir because he uses this machine already 3 years. And yesterday when I said, fix me, he said, okay, let's try this one. And I said, perfect, so you're coming to my talk now.
So is the effect also much better because it's more diffuse?
Exactly, you're
rather
covering
than specific points like you were
exactly,
doing.
exactly, exactly. So of course with injection I can do these points and I can find these points quicker. And I can show you my back because I shot myself maybe 15 times. And then I went to see Vladimir and he said, what's wrong with your back? Because I had the 15 15 spots on my back.
So this is better than the shots?
Yes, but it's very costly. To buy this machine, I don't know how much new one cost.
Okay.
Around 3,000 maybe. So it is brilliant machine, but that was what I tried yesterday first time in my life, and it worked. You know, yeah, my back is, maybe it's combination of my shots and Vladimir's.
What injection? You said earlier, but I forgot.
I injected myself with Tromil.
Tromil. Tromil is from
Heel.
Heel,
from
Germany.
yes.
Yeah, Heel.
Yeah.
Yeah.
But just on the main thing that this magnet machine is doing is it's speeding up the penetration. You
Yes.
could also put the same thing on, put a huge bandage in, and 24 hours later it will go
Yes,
in anyway. Yeah?
exactly. So you know the castor oil,
Yeah.
castor oil treatment. You know, you
Yeah.
can put castor oil, put cling film, slip over, and the castor oil will be through skin and doing the same anti-inflammatory beauty.
Or do you know DMSO gel, which is
Yes.
also for caries. It's true.
Exactly. So exactly, this is just speeding up the penetration of the medicine through the skin.
So you can do it in 10 minutes rather than
Waiting all night.
I'd say
Exactly.
it probably feels very pleasant as well for the patient.
Naida, how it feels?
Oh,
There's the answer.
take that as a yes.
I'm usually sleeping here, enjoying.
Assuming the pacemaker is off the question.
I don't know.
Magnetic? Metal?
Any contraindications? It is magnetic field. It's not electrical.
Yeah, just водитель ритма только нельзя.
Yes,
то
pacemaker is not.
спросила, да,
Yeah,
да.
pacemaker is off.
But it won't disturb the pacemaker.
It shouldn't disturb pacemaker because
You're
it's
not sure.
yes, but you're not sending electrical current. It is magnetic field, and it's always on instructions. They will say don't use it for.
Других нету противопоказаний. No, у нас
At least this one have no consumables, whereas the other one has the needles and the syringe.
Yes,
Yeah.
but as I said, one needle with one syringe costs €2,
Yeah.
and the device to buy from China around €50. And if you buy 100 needles and 100 syringes, it goes down to €1. You know, so more you buy, cheaper it is, and so because beauticians are using that crazy, ladies are buying and using themselves, so you can buy hyaluronic acid, you can buy the device, and it will be still 5 times cheaper than going to beauty and having a baboon lips, you know, done. So full internet and YouTube is how the ladies are using this injectable self-treatment with hyaluronic acid all around the face. And yes, so it's crazy. But in medical hands, it looks very sophisticated. And that's it, 10 minutes done. So now when you lift the plastic, the gel will still be on a skin, but medicine will be all through now skin. So sorry we went 15 minutes over, but I think it was worth seeing. And
does it feel?
Good.
Is the pain gone completely?
Yeah, how long does it take to work? for the pain to go?
No, it's not working quickly.
It's for me, I felt straight away better after procedure, and then after 1 hour, pain was gone. Around 1 hour later.
So I'll tell you.
And you can check her neck because you will see the redness settling, and we will see exactly for how long Naida's reaction to the injection, because you can see it's still a little bit red, but it is already settling.
But no blood, no blood.
No.
Я делал 5 минут всего лишь потому, что это самое.
And this was only 5 minutes to make it quicker.
Thank you.
Are you talking more about this?
No, not anymore.